Hey everyone, I'm really excited for today's conversation. I have on Sarah Thompson, and she is a pregnancy functional medicine specialist. She's going to tell us exactly what that means. I've been following her on Instagram for a while now, and the information that she puts out, I always feel like I am learning so much. She focuses on the health of moms and how that affects birthing outcomes and different things like that we don't even know. Like nobody tells you about that. Like your OB's not like, hey, if these different health things are going to affect your birthing outcome, like there's no course on life. So this is really, really cool. And I'm really excited to talk to you. So thank you so much for coming on the podcast.
Thank you for having me, Elizabeth.
Yeah. So I'd love for you to tell us in your own words what exactly you do.
Yep. So, what I do is functional medicine, and I specialize in the preconception through postpartum phases. And in our specialty, what our primary goal is to help support the physiology of the mom herself. I believe that if mom is healthy, baby is going to be healthy. And there's a lot that goes into that, of course. And functional medicine is roughly defined as root cause medicine. But the way I describe it is more of a whole picture medicine, because what we're doing in functional medicine is we are taking into account the physiology, how the physiology interworks with each other. So how does the digestive system interact with the brain? How does the endocrine system interact with other parts of the endocrine system and the immune system? And then how do diet and lifestyle and environmental factors also play into the physiology?
Mm-hmm. Yeah, that's so fascinating. So, like I said, we're just kind of told you're pregnant. These are the foods you can eat. These are the foods you can't eat. Yes, you should have some movement, but kind of whatever's going to happen is going to happen. It's out of our control.
Mhm.
Um, so what could potentially be in our control?
Sure. And one of my big sayings in practice is control what you can, let go
Right.
of what you can't control,
Yeah, for sure.
right? Because there are elements of pregnancy and birth that are out of our control, right? We are working with another person.
Right.
And that is out of our control. But what is in our control are the choices that we make on a day-to-day basis. And the majority of those choices are going to be our diet and lifestyle patterns. And there are lots of studies that link certain dietary patterns, certain lifestyle patterns with different birth outcomes. And that is something in which we all have an element of control over. And of course, there are people who live in areas of maybe, food desertification where they don't have as many options as somebody who lives in an area where, maybe there's a Whole Foods right down the street. Uh,
Mm-hmm.
so, so there are those things that, again, are within our control and without our control. Uh, and in functional medicine, I think a good practitioner should be able to help people of every demographic
Yeah.
achieve these same goals with what they have at their availability.
Mm-hmm. Could you give an example maybe of um like how you said that there are certain things that we know like affects that birth outcomes? What would
Sure.
be a couple of those things?
So it's a very deep conversation when we're talking
Yeah.
about what goes into birth outcomes, because you have to go back and understand what is the birth physiology. And birth physiology is complicated. It actually begins way back in the second trimester. Most people don't realize the body is actually starting to prepare for labor and delivery
Right.
all the way back at, about that 24 to 28 week mark. And there's a lot of nutritional support that goes into supporting that physiology as it makes changes. You'll see things like vitamin A, for example. In the third trimester, there is a six-fold increase in the need for vitamin A. That's a lot of vitamin A.
Yeah.
Vitamin A is required for the genetic expression of oxytocin and oxytocin receptors.
Hmm.
Kind of a big thing when you want to have a baby.
Yeah.
It's a big part of labor and delivery.
Right.
And if for some reason you are vitamin A deficient, you may produce less of the genetic expression towards oxytocin receptors. And therefore, when active labor is initiated, have less receptors to work with.
Hmm.
And this is a pattern that you'll see with people oftentimes who maybe, they got Pitocin in labor and the Pitocin really didn't even make their contractions move forward. There
Yeah.
was nowhere for it to attach.
Yeah.
So, so that's just one, right? And there's a lot of things, again, that are happening in the maternal physiology as we lead up to that labor and delivery experience. Lots of interconnected pieces outside of just nutrition, but you've got huge hormonal complexes that are interacting with each other. And it's kind of this communication between the fetus, the placenta, and the mother. And they all have to be working together, right? Like little cogs in an engine, in order for the mother's body to do what it needs to do to go into labor and delivery months down the line.
Yeah. I had no idea about that vitamin A thing. And again, that's something that we're not told. So it's not like, hey, in the third trimester, let's make sure that you're getting good bioavailable, sources of vitamin A because you need it. Like, it doesn't.
It's one of those things, and one of the things that I think that has always frustrated me a little bit about prenatal care is that we tend to focus so much on, well, baby's happy, baby's growing well, versus the entire complex, which is baby, placenta, and mom. And again, I feel like if we have a happy, healthy mom, everything else falls into place. To grow a happy, healthy placenta, you have to have a happy, healthy mom in the preconception phases. The beginning of placental development happens in the first couple of weeks of pregnancy, often before a mother even knows she's pregnant.
Right. I know. It's mind blowing. Have you heard some of that research that, I haven't read too much into it, that the placenta actually comes from the father?
I have seen a little bit on that. And when you look at, you have to understand the embryonic developmental side, right? We are taking two sets of DNA and, and creating life from that. Now, we do know that the placenta does have a biological sex, just like the baby. So you have male placentas versus female placentas.
I did not know that. That's wild.
Yep. And they work differently.
Wow.
And so you'll see that there are some similarity patterns between male placentas and fetuses versus female placentas and fetuses. And there is just a slight difference in actual needs of those placentas.
Wow.
So they
and that, again, that's like
things.
Something that we're not told. It's not like, so if you're carrying a male, you're going to have a male placenta. That's like, okay. And then some of the needs are different.
Yes. So the actual placentas express different genetics. And it's partially because a male baby and a female baby actually need slightly different support during those developmental processes.
Wow.
It's just like breast milk. So I'm sure you've seen those studies that talk about breast milk is different between male babies and female babies from mom.
I have actually never heard that either. I've heard that like your breast milk changes based on like when your kids are sick and, different things like that based on their needs. So your baby, that our nipples actually have receptors and is taking in for information from their saliva, telling us what they need, which is like so cool. But I didn't know that it was based on sex either. Like that's mind blowing.
Yeah, so you'll see different ratios of macronutrients in breast milk based off of whether the baby is male or female.
Wow. This is all just like blowing my mind right now. So then would you recommend, so I'm pregnant with our third right now, and we've never found out what we're having. Would you recommend like finding out what you're having so you can meet those needs, or is there like still like a baseline that you can meet it either way?
There's still a baseline. Right. And I actually find that what somebody craves in their pregnancy can also be a clue as to what they're having, because it's very interesting, or what their needs are. I guess I should say that, because oftentimes the body really does tell you. It's like, when you have certain, nutritional deficiencies, you do see certain cravings. Chocolate, for sure. Magnesium, right? Oftentimes I find that at specific phases of gestation, women will crave like orange juice or something super high in vitamin C. Like, oh my God, have you tried those strawberries? Those things are amazing. And I've been eating like a pint of strawberries a day.
Right.
And usually there's a reason behind that. And you'll find that at certain phases, you need more vitamin C.
Right.
And so it's kind of the body's way of saying, hey, we need those antioxidants. Focus on that.
Right. I feel like in each pregnancy, I've gone through like a citrus craving where there's a period where I'm like, I feel I don't remember what recipe I was making. I made something with lemon and it had like lemon zest in it. And I was like, the more the better. Like I want this to be like the most lemony thing I've ever tasted in my life. Or even like in water. It's like, I just want lemon in my water. But that's super interesting. I will say this pregnancy has been, I've craved the least amount of junk this pregnancy. I try to do like pretty well. I feel like we eat pretty healthy. But also like if I'm craving something, whatever, I'll like have some of it depending on what it is and if it's available. Cause I don't keep like, I don't have ice cream in my freezer. So if I'm like craving ice cream, and if it's not there, I just like move on, you know. My husband got me some the other night, but I feel like that's like the only time like I've had that. But like my other pregnancies, I would have like weird cravings or very strong aversions. And this one, like not really. My last pregnancy, I had a really hard time with meat the entire time. And I know how important protein is in your pregnancy. So I could have it in a bowl. Like I'd make a steak bowl with like rice and veggies, but I couldn't just eat a steak. Like I couldn't bring myself to do it. If it was wrapped in a burrito or in a bowl, like any way I could hide it, I could do it. This pregnancy, like no problem eating meat. So that is super interesting. I'm curious, like, what have I been craving this pregnancy? What am I having?
Right. Well, and sometimes it does. It plays into other vitamins and minerals, and like I'll find that oftentimes those meat aversions come about due to certain things you'll find in the body. Sometimes it can be because you have too much of certain minerals, and your body you can really taste it. You're like, oh my God, that's like off-putting.
Yeah.
So zinc is one of those. Where if you have adequate amounts of zinc in the body, you can taste it. And it tastes very strong.
Yeah.
Remember as a kid when you used to put coins in your mouth? Because we don't do that as adults, right? That's not something we do. And remember how gross it tasted, that very metallic, bitter, almost drying sensation. When you have adequate amounts of zinc, it's almost the same flavor you get from foods. Where I've had times where I'm a huge fan of liver. I love liver. Like I grew up eating it. I actually really enjoy the flavor, like duck, same thing. I love that really minerally taste. But I have had times where I've had it and I almost have to spit it out, where I'm like, oh my God, this was bad. Like but it's not that the liver itself was bad. It's that I probably actually had adequate levels or even too much in the system. And my body is saying, don't eat that.
Interesting. It's interesting how I guess like mineral deficiencies or sufficiency can change your palate. That's crazy.
We have lost our innate ability to listen to our cues. And it starts in childhood, right? When we
finish everything on your plate.
Right. And kids are really good about knowing what they want.
I
mean, how many kids out there, I can talk, very, very loudly about my kids in certain phases of their development. All they wanted to eat was fruit.
Oh my gosh.
Right?
Yes.
They go through a huge fruit phase. And it's partially because sugar grows babies, sugar grows kids. Kids actually need a significantly higher amount of carbohydrates in their diet because they're developing. And cellular growth requires a quick, fast energy source, which is going to be a carbohydrate base. Yes, they need proteins. Yes, they need all the other stuff, but they actually need a significantly higher amount of carbohydrates to grow. And you find that they just crave it. Right? They need that in their diet. And if we don't give them a healthy option, they're obviously going to go off to the candy world because it's in here. They can't help it. Their body is saying, I need a carbohydrate. I need that in my world.
I feel like my kids could live on fruit. It is, I just went grocery shopping the other day and I'm like, I have to buy like double because I try to just go grocery shopping once a week. And I'm like, by day 5, like we are out of everything that I bought. And it's so crazy. Like even the other day, I'm like, I spent $8 on blueberries and they lasted like 24 hours. I'm like, this is ridiculous.
I know. It hurts the heart and the wallet, doesn't it?
Oh, for sure. For sure. But what I find is actually really, especially in the summer, like My kids love frozen fruit, and it's so much
Mhm.
more cost effective, especially if you're buying organic. It's so much cheaper. My kids love frozen mangoes and frozen blueberries.
Yeah.
So I'm there. I'm like, okay, perfect. Like
Yeah.
that's doesn't hurt the wallet as much, lasts longer, you know,
Yep.
in your freezer. Um, but they love snacking on frozen fruit. But that makes so much sense. So I'm curious, in pregnancy. So one thing that I find, we talk a lot about the gap in care postpartum. The first trimester, I know so many people, which I haven't really had this experience. As soon as I call them and I'm like, hey, I have a positive pregnancy test, um, I've been able to go in like really
Mhm.
soon. Um, or, you know, like within the first couple of weeks. But I've had a lot of people be like, they're not going to see me until I'm 12 weeks.
Right.
And so there's no, but even then, like, even if you, a lot of places, if you can get in sooner, there's no guidance in like
Sure.
that gap in care in your first trimester as far as nutrition. Mentally, most moms are really stressing out. They're like, is the baby okay? I haven't been to the doctor yet. You can't feel anything yet.
Mhm.
What's going on? Oh, I spotted a little bit. Like it's such a
Yeah.
mental game. There's so much anxiety, and you just want to go to the doctor to know that everything's okay. But then there's the no guidance. You with morning sickness, with
Yeah.
other things that could be happening. So I'd love to know kind of like your approach when people are
Mhm.
coming working with you. How do you approach the first trimester?
Oh, we hug that first trimester
Yeah.
because it's very, like you said, it's a big unknown, and you're kind of just left to fend for yourself with this idea of, in the conventional medical world, they're like, well, we'll wait till 12 weeks when you're out of the risk factor range of loss, because there is a
Right.
percentage of loss.
Right.
And unless you've had recurrent loss, right, they don't even want to see you until you've gotten out of that first trimester. And partly it is because what you're doing in the first trimester has some effect on what's happening, but not very much.
Hmm.
So, fetal growth, everything that happens in those first couple of weeks of pregnancy is dependent on what you did the 3 to 6 months before you ever got pregnant.
Yeah.
So, when we go into fetal development, embryonic development, within the first couple weeks, we have the division of two groups of cells. We have the placental cells and we have the fetal cells, right? The placental cells are growing. This is that first phase of placental development that I always talk about, which is the genetic expression of all of these different cells to infiltrate the endometrial lining and create spiraling blood vessels that will connect maternal to fetal, right? That takes weeks to complete. At 6 weeks, there's a little bit of a connection there, and you start to see a transport of some nutrients, so sugar primarily, and thyroid hormones, and some of these things that go into helping the fetus grow from that
Yeah.
point on. Up until that point, that baby has brought everything it needed to grow and develop,
Yeah.
right? From preconception. This is where preconception becomes a very big part of miscarriage prevention,
Hmm.
right?
Yeah.
Once you're in the heat of it, it's acute crisis management.
Hmm.
And in the first trimester, oftentimes it's when I say, hey guys, take a break on nutrition. Like
Hmm.
I don't care if you can't swallow your prenatals right now, because we did so much great work preconceptionally that you should be able to get through this couple months of maybe not eating the greatest.
Yeah.
Okay. And one of the things that we see, and again, remember I said sugar grows babies,
Yeah.
right? The majority of cases of morning sickness are due to hypoglycemia or blood sugar dysregulation. And in the first trimester, there can be upwards of 15 times the amount of insulin produced by the pancreas, by the beta cells of
Wow.
the pancreas. And this is stimulated by HCG. So HCG is that pregnancy hormone. It's what
Yeah.
helps you get to that positive pregnancy test. And HCG hijacks the maternal physiology to give that little growing embryo down there what it needs. And it needs a couple of things. Number one, it needs hormones, right? Progesterone. That's a big one. So HCG hijacks the ovary and the corpus luteum to help produce progesterone and estrogen. Okay. Thyroid hormones. HCG looks like, acts like TSH. It binds to TSH receptors and tells the thyroid to produce 25% more thyroid hormones in the first trimester.
Wow.
Right. And for those people who don't even know what their thyroid hormones do, their thyroid hormones are a big part of genetic expression and metabolism. So that baby can't make its own thyroid hormones. It can't metabolize any of the nutrients, the sugars, the fats, the proteins, any of that without the help of mom's thyroid hormones in the first trimester. So at 6 weeks, that's when we start giving thyroid hormones to our cute little growing baby down there. But we got to give it food to actually metabolize. And the primary food source of quick, rapid development is sugar.
Yeah.
And so you see that HCG also hijacks the pancreas to produce this large amount of insulin in mom's body. And so most of her sugar that she consumes in her diet gets bound to this insulin and transported down to the growing baby. Therefore, she is prone to low blood sugar moments.
Yeah.
It's why you'll find people who the only way they can keep from being nauseous in the first trimester is to eat frequently and to eat a lot of carbohydrates. I mean, how many women say, oh my gosh, it's crackers and bagels and cream cheese. That's all I can seem to keep down. Or fruit smoothies, right? Fruit smoothies tend to be one that I see. Or mashed potatoes. That's one that I've seen people like, I can just eat mashed potatoes for breakfast.
Yeah.
There's a reason that the body is craving these starchy and carbohydrate rich foods.
Yeah. Huh. That's so interesting because again, you just read that like there's no explanation for morning sickness. You know, like there's no explanation for anything that happens. And so it's like really cool learning about this because it makes sense. So then knowing that that's what's happening, is there something you could do to like maybe decrease your chances of being sick?
Sure. There's a lot of things that go into it. There are some genetics associated. I have an entire chapter in my book on pregnancy nausea because it is such, I feel like such an important one and such a common thing that we see and something that is debilitating for a lot of women.
Yeah.
There's also a lot of reasons behind it. So there are some genetics.
Yeah.
And interestingly, the genes that have been associated with more severe morning sickness, so like the hyperemesis type patterns, are blood sugar regulating genes. Where these people can't seem to, for the life of them, release their stored glucose to keep their levels from plummeting into actually hypoglycemic patterns. And if you've ever worked with somebody who gets hyperemesis, they literally are going into hypoglycemic shock when this happens. And I've had women who like literally are telling me they're just like almost about to pass out. They're shaking, right? Right? They're like doing that and vomiting at the same time. And it's literally a hypoglycemic shock type scenario in some of these cases. You also see studies that talk about hormonal production, right? Estrogen in particular has been associated with, outside all the hormones, HCG, progesterone, estrogen. Estrogen has the most association. You do see studies, and I do have these linked in my book, that talk about people who are on birth control, combination birth control pills prior to conception have higher rates of nausea. And we do know birth control depletes things like B6.
Right. Well, I was just going to say, I was going to ask you, because I know like one thing as a doula too, that B6 is related to nausea. So like if I know somebody who's really, really struggling, sometimes I'm like, you know, maybe you can supplement with this, try it out, see how you feel. And I just did that proactively this pregnancy and I really didn't get sick. So, I was like, around 5 weeks, I'm like, I'm just going to start taking some extra vitamin B just to see, from like a really good source that I knew like it wasn't just going to not be absorbed in my system. But I would get a little nauseous before bed. That's like always when it would hit me, is at the end of the day. And I'm not good. Like we'll eat when we eat early. I don't eat again before bed, you know? And so I'm like, man, I'm sure I need like a snack or something. But yeah, I was going to ask like, why does that B6 thing work for some people with nausea?
Yeah. So the way B6 works is still kind of a mystery. We just know that it has anti-vomiting properties.
Oh, interesting.
Probably related to neurotransmitter function more than anything.
Yeah.
So B6 is a big part of regulating our neurotransmitters. So it goes into the production and regulation of serotonin, dopamines, adrenalines, norepinephrines. Serotonin is our primary neurotransmitter of peristalsis or gut motility. 95% of all serotonin is actually produced in the gut itself.
Yeah.
So there are some back and forth on maybe why, but there isn't anything exact.
Yeah.
What we do know is there was another cool study done specifically on B6 and nausea in pregnancy. And for those who don't know, primarily what you get in supplemental form is going to be the pyridoxine HCl4. Okay. Now, we also have active forms in the body, and there's quite a few. One of them is called P5P, or pyridoxine 5-phosphate. And when you give, what basically what the study came up with was that the active form that actually has the benefits towards reducing nausea is the P5P form. So this specific active form of B6, which is the form that is used in neurotransmitter regulation. So oftentimes, if I'm going to try a B6 on somebody, I have them take the just actual P5P form.
Yeah.
There's a great company that has the Designs for Health actually has a liquid B6 that's in the P5P and combo pyridoxine form.
Nice.
And it's liquid.
Yeah.
So much easier than trying to swallow pills when you want to vomit.
Right. I know. I've actually never thrown up in a pregnancy, so I haven't like had that much nausea. I've had like a little bit here and there, but the only time I've thrown up is brushing my teeth. For some reason, as soon as I'm pregnant, I gag so hard brushing my teeth, and it's so annoying. You're like done brushing your teeth, and if I like barely brush my tongue, I'm like, "Ugh," and then I'm like, great, like now I have to brush my teeth again. Like it's like not a nauseous thing at all. It's like a weird feeling. Like I can just feel spit in the back of my throat and it grosses me out. I'm like, I don't know what's happening, but every single pregnancy, I just like the other morning, my daughter's like, are you okay? Cause I was like dry heaving, like brushing my teeth. I'm like, yeah, I'm fine. But yeah, there are so many things in pregnancy, again, that it's just kind of like these things are out of your control. And you had mentioned miscarriage. I've had two. The first one was a chemical pregnancy. So it was like at 5 weeks. And then the next one was at 8 weeks. And so I was really nervous about this pregnancy because how it started was chemical pregnancy, live birth, miscarriage, live birth, and then I'm pregnant again. So I was like waiting for the ball to drop. However, before this pregnancy, I really did focus on just like, thankfully, through following people on social media and learning a lot. When I was like 6 months postpartum, I started making sure that I was getting in 30 grams of protein every morning before having coffee, before doing anything like that. Getting to bed by 10 o'clock every night, and just really focusing on replenishing some nutrients. I did a mineral deficiency test, and some stuff came up, which I feel like being pregnant and postpartum, my needs are continually changing.
Absolutely.
But I really did focus on that. Like for me, I feel like, again, the gap in care postpartum, like you shouldn't be like focusing on losing baby weight. You should be focusing on replenishing your nutrients and your minerals and your vitamins and stores, because so much is being depleted from you in pregnancy and in breastfeeding. So I really tried to focus on that. And so I don't know if that like made a difference coming into this, but I would love to just kind of know, like, if there are some things that you could potentially do to like nutritionally or functionally to prevent miscarriage.
So that's a big game because there's a lot of things at play again.
Right.
So with functional medicine, of course, being whole body medicine, we look at different things. Obviously, nutrition, like you said, pregnancy takes a toll on the nutritional counts, right? If you're looking at the max increase in some of these nutrients, I mean, like we said, it's a 10-fold increase in the need for vitamin D, 6-fold increase in the need for vitamin A. And a lot of these we don't even know.
Right. Yeah.
Folate, B12, zinc, copper, the list goes on as far as the increase in needs of these hormones. Iodine, 50%, selenium, 40%. And you have to recover from that.
Yeah.
And I've seen varying degrees of research that says how long it takes for somebody to recover from a birth experience. And we're talking a normal pregnancy and birth experience. And you'll see, and if they're breastfeeding, right? All these things play into it. But on average, it takes 2 to 4 years to recover from a pregnancy experience. right?
Wow.
2 to 4 years.
Yeah.
And we're not just talking nutritional, we're talking hormonal, we're talking stress reactions from that, the buildup of inflammation that occurs through the pregnancy experience. And I think in our society, we have forgotten to hug the mom afterwards.
Yeah.
Like, all right, you had a baby. We passed that postpartum 3 months, right? And we've started giving him the
Right.
3 months now. It used to be, oh, you're fine. It's been, a couple weeks. Get back to work. You're good.
Right.
No big deal. But I can tell you, my list is long of women who have told me it took them 3 to 4 years before they felt like they were back to themselves again.
Right.
Right? Whether it was just how they felt on the inside, their fatigue levels, all of this. Nutrition is just one of those. Cortisol. Cortisol is a hormone we don't talk about very much, but it is critical for every aspect of pregnancy. For those who don't know what cortisol is our stress hormone, right? That's what it's termed as, our stress hormone.
Yeah.
Every cell in your body has a receptor for cortisol on it. It regulates neurotransmitters, it regulates your immune system, it regulates neurological function, it regulates everything. Hormone outputs, thyroid function, your heart rate, your blood pressure, your blood sugar levels, all of that. And throughout a normal pregnancy experience, there's a 500% increase in the production of cortisol.
Oh my God.
That's huge, right?
Yeah.
Right? And it doesn't stop at birth. Unlike some of these hormonal surges that you see, like estrogen, once the person producing the estrogen, primarily the organs producing the estrogen are going to be the placenta. Once they're gone, those hormones drop, and we can recover from that. Cortisol is interesting in the fact that you see it elevated postpartum, and you see it elevated while people are breastfeeding. And it's not until either babies start to accumulate or start to consume solid foods, and we see a decrease in the breast milk production based off of they're just eating more of the other foods and not getting as much milk, that we see those cortisol levels starting to come down. Okay. And your body has to recover from that. When we're looking at the normal ups and downs of cortisol production, our body isn't meant to maintain these high stress responses for a long period of time. It's why you see studies that talk about long-term stress and degenerative diseases, right? So if you factor that on top of just a normal pregnancy experience, you have to recover.
Yeah.
When you look at the normal physiology of stress responses, in a normal stress response would have been like an acute scenario.
Yeah.
Right? You should be getting a recovery period from that. I have a bunch of analogies and examples that I use, but typically what would happen, and I'm sure we've all experienced that, we've gone through a big adrenaline rush.
Yeah.
And then we are exhausted for days afterwards, right?
Right.
We have to recover from that. Pregnancy is one of those things that you have to recover from it. And granted, the elevated cortisol postpartum does have a purpose. It's what's going to keep you alert and make you not need as much sleep in those first months when your baby isn't sleeping.
Yeah.
It's what makes you alert, because you have to keep that new person alive.
Yeah.
Right? You have to be alert to their cues. You can't sleep through them trying to get your attention.
Right.
But there is a reason why you see this. It does have a reason. You can have too much, you can have too little based off of your birth experience. And again, you have to recover from that. And that's one of those scenarios that if we get a really rough pregnancy, a really rough birth experience, the recovery from that is longer because we have the psychological and the physical.
Right.
So that's something you have to recover from.
Yeah.
Thyroid, we kind of talked about that a little bit. Thyroid hormones are kind of the same thing. You'll see that thyroid hormones can be a little, I like to say, wonky in that first year postpartum, based off of breastfeeding, based off of these cortisol responses, and based off the fact that your thyroid just got overworked and underpaid for the last year.
Yeah.
Right. A lot of people are diagnosed with hypothyroidism after having a baby, where their thyroid goes, oh, thank God that stimulation is gone. I can take a break. But it can't, because you also need to function. But then it can't because it's also just toxic, right?
Yeah.
So those are all things that we kind of look at, like definitely stress responses, nutrition, thyroid, hormones, all of that can play into that postpartum recovery.
Yeah. I know that our doctors, like every time I've been pregnant, they've tested my thyroid, but I know that tests that like a lot of offices run aren't like the same as like a functional medicine doctor would run.
Yeah.
Even in my 20s, I had some thyroid issues, and I worked with a functional medicine doctor who, broke down the T3, the T4, my DHA, what is it?
Probably
D.
DHEA wouldn't be something that you would
No.
typically run with a
Well,
thyroid panel.
what's your female testosterone?
That'd be DHEA.
Okay.
Yeah, it's DHEA. It's not, you have testosterone. So DHEA
Right.
is its own separate hormone. It's produced by the adrenal glands. It is converted by different enzyme, like aromatase enzyme takes it and converts it into your estrogens. You've got testosterone, which can come from that, and DHEAS.
Yeah. Well, whatever she did, it was like broken down, like tons of different things. And yeah, my DHEA was like, I was in my mid-20s and it was that of like a 50-year-old lady. It was like super, super low. Some stuff with my thyroid, but I was like so grateful that I worked with her, because I was able to work with her for a couple years and like recover, like get things back on track, versus like getting on a medication that I had to rely on the rest of my life. I'm not even sure if this would have shown up in a normal panel, because I think I had been like tested and it was like, oh, everything's fine, like your thyroid looks fine. But when you break it down, it's different. So how are those, like, because I know every time I've been pregnant, they test my vitamin D levels, they test my thyroid. Like, are these accurate depictions of like what we actually need or what's going on?
Yes and no.
Yeah.
Yeah, it's
Like
a
it's a
little bit of
baseline.
both. It's a baseline,
Yeah.
right? And oftentimes in the maternity, pregnancy, functional medicine world, we're not at the luxury of being able to test and treat a lot of these big underlying things.
Yeah.
Simply because we don't have the time. And it becomes acute crisis management, a lot of it, right?
Yeah.
We're trying to identify the negative patterns so we can help this pregnancy that we're working on become the most functional experience of this person's life. Sometimes that does require the acute crisis management of medications, with the idea of postpartum, let's revisit this and let's recover from this. Because a lot of that stuff, like you said, how many years did it take you to recover from that?
Right.
Right? You don't have that time in pregnancy. That's where that preconception work comes in. That recovery postpartum comes in. Giving your body grace in that recovery pattern. And knowing that if something does pop up in pregnancy, you sometimes have to do what you have to do the necessary in this immediate, and say, we just got to get through this moment, because actual recovery may take you a full year. We have 2 weeks until this hormone is needed for this process in the body.
Yeah. 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 I always wonder, I'm like, is that like actually, like, are my vitamin D levels okay? Or are they just like, because even like the RDA, you know what I mean? Like the required daily, whatever it is, of the vitamins that you need, it's baseline. And so that's even like most prenatals have baseline what you need. And it's not like your prenatal changes based on trimester. It's not like in the 3rd trimester, you get a prenatal that has more vitamin A in it,
which you should.
Right. Which I just learned today. I actually have some vitamin A. I have the Seeking Health vitamin A drops. Would that be okay to just like take in my 3rd trimester?
Not necessarily. So I'm a big fan of diet. Because supplements you can hurt yourself with. And supplements are made to supplement.
Right.
They're not made to complete. They're not made to be everything. And everybody is different. So I have a list of probably, 20 different prenatals that I bounce back and forth with people. And for a lot of people, we don't even do prenatals because they don't need them based off of their diet, where they live, so many different factors. And I've had people who actually cause damage to themselves by taking some of these prenatals because they didn't need everything that was in that, even though it was a basic prenatal. Or they're taking a souped up prenatal with all the methyl Bs and all of that kind of stuff, but really they needed a really basic one because they actually do a pretty good job. And genetics play a lot into that, right? Everybody's needs. RDA is so baseline. Right. That's a minimum. And you'll see people with certain genetics where they actually need more than even the upper limit sometimes of some of these nutrients, because their genetics predisposes them to needing more. And the ancestry of these genetics I find just fascinating, simply because you'll see people with certain genetics for iron issues, for example. I've seen some studies that talk about the ancestry of the hemochromatosis genes, right? And if you're not familiar with that,
Yeah. My family has that.
yeah, mine too.
Oh, really?
Yeah, but the hemochromatosis genes in general, for those who aren't familiar, what happens is it causes a dysregulation in the hormone called hepcidin. And hepcidin's job is to regulate iron absorption. So when hepcidin is elevated, it blocks iron absorption. When hepcidin is down, we have a free flow of iron into the system. People with hemochromatosis are prone to iron overload.
Yeah.
And their hepcidin is down. So they just let all the iron into the body. And really, this gene probably originated from areas of the world in which iron was actually fairly low in the diet. And so we had to be able to maximize and absorb more easily the iron we did get in the diet.
Yeah.
So you find that people with these specific genetics actually do better on more, I hate to say it because I'm not a huge fan of veganism, but more of a plant-based diet. Where you can see things going the other way too, where you have genes that make that hepcidin super reactive.
Yeah.
Right. And those are people who tend to, and it kind of blocks their iron absorption. So there's all these different games that you can see, right? Where it changes those nutritional needs.
Right. But nobody knows like underlying that they have this, you know what I mean? Like I've actually never been tested for the hemochromatosis. I know my dad has it. It runs in his family. He donates blood as a way to like get rid of the iron. And basically I was told when you're basically in your menstruating phase of life, like for women, we kind of naturally get rid of that iron on our own. So it's like not a huge deal.
Yes.
But outside of that, then, you know, you might need to look into like other things to do. So if I do have
a couple of,
oh, go ahead.
I've had a couple of interesting cases around hemochromatosis. One in particular was a miscarriage case where she was taking prenatals with iron. She didn't know she had hemochromatosis. Her father had it, and she was getting toxic iron overload that was basically damaging the placentas. Wow. And so she was having losses in the second trimester due to placental death.
Wow.
And
right. And that's something that most people probably wouldn't even know why this is happening.
Yeah. And she was on a prenatal with the 27 milligrams of iron that was prescribed by her MFM physician.
Right.
And we took her off of iron, and we had her doing blood donations every once a month, honestly, up until she conceived the next time. And we just, I mean, with the hematologist involved, right, kept her iron levels down that whole pregnancy.
Yeah. Well, I know that my iron's been tested each pregnancy and it's been fine. I've always had great iron levels, and I've never taken a prenatal with iron in it. I remember somebody was like, oh yeah, like I've heard that iron shouldn't be a part of your prenatal, that it should be separate. And then you can supplement if you need it separately. But I've never, like, when different symptoms have come up in my life and people are like, maybe you're anemic, I'm like, I'm definitely not. Like,
not a problem.
Right. But yeah, that's so interesting. And again, that's like something that you wouldn't know. Like your doctor's not like, why are we having these second trimester miscarriages? I mean, they're thinking that, like, why? But that underlying issue, you have to dig deeper and know. And it's most people don't, you know?
And she was one of those that you didn't find it in her CBC. So her OB panel didn't show high RBCs or high hemoglobins. They were high, according to me. I thought they were high. Her hemoglobin was like right in the 15 range, but not to them. It wasn't over the marks.
Right.
And it wasn't until you ran her ferritin that was, you know, over 600 that you went, oh my God, that's a problem.
Yeah. Could that potentially play into, like, this could be like not even close. Let's say I do have hemochromatosis. With my last birth, I technically hemorrhaged after, but I didn't feel like, they're like, are you feeling lightheaded? Like, I didn't feel anything. I'm like, maybe this is just because I have tons of iron and my body's like, okay, we need to get rid of some of this blood now because you're not pregnant. Like, because we create more blood when we're pregnant. So for me, they kept checking in on me. And, I was at the birth center and I was right on the verge of having to transfer to the hospital. They're like, if you lose any more blood, we have to transfer you. And I'm like, oh, like finally, it got under control, but I felt fine. Like I'm like, I don't feel lightheaded. I don't feel anything. And I'm like, maybe this is because I have hemochromatosis. I don't know. Could that maybe be related?
Well,
Right.
you do see that a lot of women with hemochromatosis have heavier menstrual periods
Yeah.
in general.
I
That
always
is
have.
one of the signs and symptoms. There's a lot of things that play into menorrhagia
Yeah.
and hemorrhaging and those sorts of things. Hemochromatosis is a very interesting condition. Again, like you said, most women don't get diagnosed until they are either postpartum or they are postmenopausal.
Yeah.
That's usually when we get diagnosed. Another patient of mine who we diagnosed her with hemochromatosis and found it postpartum, she hadn't had menstrual cycles yet. And when we tested her blood, her ferritin was through the roof. And she was doing a carnivore diet.
Oh, okay. Wow. Yeah. So she had a lot of iron going on. Yeah, I'm wondering too if that's why, because with my first, I've breastfed all my kids. But with my first, I got my period back at 12 weeks. And I'm like, man, my body needs a break. And then with my second, I was tandem nursing. So I'm nursing my almost 2-year-old and her, and I got my period back at 6 months. And I know so many people that their cycles don't come back for longer, and it's all for various reasons.
Right.
But I'm like, maybe it is like my body's way of like, okay, we have too much iron buildup. Let's get your cycle back or something. I don't know. Yeah. Who knows?
So many reasons. And you'll have maybe the same scenario, but different patterns of symptomology from person to person, because we're all biochemical individuals.
Right.
We are all extremely different. You see that even amongst identical twins.
Yeah.
There's still elements of differences based off of the foods that they consumed, the experiences they had, the stress levels that they've been exposed to, environmental toxins. Like there's so many things that change how our genetics work and changes a lot of how we respond to different scenarios.
Yeah. I'd love to touch on because if like the health of the mother is affecting the birthing outcomes, because I've been hearing more and more stuff about this lately, that there are things you can do. So I'd love to hear your take on it with like preeclampsia and gestational diabetes, because we're kind of just told you're given that card that you're dealt, that with gestational diabetes, you could be the healthiest person in the world and you still might get it. And there's people who eat like crap their entire pregnancy and they don't get it at all, So there is like that element where it's like, okay, why me? I've been like trying so hard, doing everything I think is right. And then same with preeclampsia. I know that there's some things with genetics with that. I know certain like races get it more than others. But are there some things in our control that we could potentially do to prevent that?
Yeah. And again, both of those conditions are extremely complicated with tons of underlying etiologies.
Yeah.
Primarily, both of those conditions, the commonality that we see between those and a lot of other pregnancy complications is this idea of oxidative stress. So something you'll see is damage in the placenta, pollution in the placenta. The placentas themselves are sick. And they're sick with this idea of oxidative stress. Now, oxidative stress is a fancy term for cellular pollution. So cellular pollution, it happens every single day. You and I are making pollution in our bodies every single day, just being alive. And our cells, so every cell in our body is taking our calories, right? Remember that whole glucose thing we talked about?
Yeah.
And turning it into energy. And just like putting gas in your car, we create pollution.
Yeah.
And we have to clean that pollution out every single day as well. And we clean that out by sleeping and through antioxidants.
Yeah.
Now we have antioxidants in the diet. We also have innate antioxidants that we produce in the body. The placenta produces a lot of pollution. And in fact, one of the things that triggers active labor is a certain level of pollution in the amniotic fluid and in the placenta that triggers the brain to say, this thing's toxic. We got to get it out of here.
Yeah.
Okay.
Yeah.
But there's an element of pollution that if the cells become too sick, if the cells start to look like LA or,
Yeah.
or
China,
Tokyo.
Beijing.
Yeah, exactly. I've been to Beijing. I actually have studied in Beijing. I did my internship out there. There were days you couldn't see the buildings across the street. It was so
That
bad.
is
So
wild. Yeah.
it was rough. So yes, let's use Beijing.
Yeah.
So if the cells start to look like Beijing, what happens is you start to shut the cells down, right? And something that our body does is this idea of cell death.
Yeah.
So you can destroy cells that are too sick.
Mm-hmm.
And if cells are sick, they can't see clearly, they can't function correctly, and they start to, become dysfunctional. And when we have high rates of oxidative stress, we see a decrease in function of those cells. And that can be a decrease in the production of different enzymes that are needed, a decrease in hormonal production, such as progesterone. The placenta produces the majority of the progesterone after a certain time in gestation. You also see that the body makes a lot of antioxidants, and that the placenta itself is full of these innate antioxidants. So things like glutathione.
Yeah. I actually just wrote
Right?
that down. I'm like, I got to ask her about glutathione then.
Superoxide dismutase. Right? These are all very important antioxidants that
Yeah.
their job is to come into the system. N-acetylcysteine, alpha lipoic acid. These are some other good ones. Their job is to come into the system and clean that damage out so that we don't become toxic. Now, with preeclampsia, something that you see across the board in pretty much every case of preeclampsia is an element of placental dysfunction and placental toxicity. Now, what's the driving factor there? Well, that's where it gets interesting, is there are genetics at play, right? And there's different patterns of preeclampsia for sure. Some of it is going to be, all cardiovascular. Some of it is just going to be that the placenta itself is dysfunctional and we're seeing issues there. Some of it is going to be kidney related, right? The kidneys themselves, that goes back to maybe a little more cardio as well. But there's a whole number of factors why we're going to see this placenta giving up or starting to struggle and become diseased itself.
Yeah.
Because that's what it is. It's diseased.
Yeah.
Right. Sometimes it has to do with how the mom came into the system, that genetic predisposition. Certain dietary and lifestyle patterns do predispose you to this, right? If you already have cardiovascular oxidative stress, well, you add this increase, remember, 500% increase in cortisol, part of that is cortisone. Cortisone is our body's natural anti-inflammatory. Think hydrocortisone cream, right? What do we use that for? We're reducing inflammation on the skin. Same thing, your body makes its own to help your body not feel this inflammation.
You're like, what do we use that for? I'm like, hemorrhoids.
That too, right? So many things. So many things. Sleep. Sleep is a big one, right? You do see higher rates of preeclampsia in women who have sleep apnea.
Oh, wow. Interesting.
Right? You do see that certain childhood patterns. Now, this would go back into some epigenetic sides of things, right? Sometimes preeclampsia, the true prevention of preeclampsia begins in childhood, is one of my sayings.
Wow.
Right? So oftentimes when we're working with people, we're trying desperately to help the person in the room. But in the end, one of our big goals is to prevent these complications from creeping up later, right? How do we prevent it in the next generation?
Right.
The daughter you're carrying, you may have been given some genetic, situations or been put in a situation where we're going to control what we can and let go of what we can't control. But how do we make it better for the next generation?
Right.
That's the other goal of what we do. Nutrients, right? When we're talking about preeclampsia, there's a lot of nutrients that go into placental function. A lot of those are antioxidants. A lot of those are methylation components. It used to be theorized that preeclampsia was a disease of B vitamin deficiency. Talking way back when nutrition was still a part of Western medicine, it was actually its own doctorate in medical specialization. And we do not know that there is a link to certain methylation genetic patterns and preeclampsia. So there's a lot of things, and understanding how do we prevent preeclampsia for somebody depends on a number of factors. Right? You do see that older moms are at higher risk of preeclampsia. Well, I hate to say it, but as we age, we do age, right? I know, like, I'm in my mid 40s now. I hate to say that I'm aging, but I am. I don't recover as well as I used to, right? I need more sleep than I used to.
Yeah.
I have a glass of wine, I feel it the next day,
Right.
right?
Yeah.
Right? It hurts more. And it's because we don't detox as well as we did when we were in our 20s.
Yeah.
We produce more pollution and we have a harder time cleaning it out of the system. Our body produces less of the innate antioxidants as we age. And that sets you up for a pattern of oxidative stress in your pregnancy. Therefore, an increased risk in the diseases associated with that oxidative stress, which is why you see, again, things like coenzyme Q10. That is an
Yeah.
antioxidant with a pretty good scientific track record in helping to prevent or decrease the risk of preeclampsia in advanced maternal age moms.
Interesting. I've only really heard about that for sperm health.
Oh, really? Yeah. It's good for sperm health too.
Yeah.
There's a researcher in Ecuador, actually, that does a lot of research on CoQ10 and specifically preeclampsia.
Oh, wow.
Mm-hmm.
I've never heard that link before.
Yeah.
Yeah. So again, it's like, it's one of those things where it's like, it's kind of out of your control. You don't know that like you're at risk for this going into it. So
Right.
you don't know that there's things you can do to prevent it
Yeah.
potentially.
And I think knowing your general baseline foundational health going into pregnancy helps you know what are my risk factors and what do I need to look for. So when I
Yeah.
look at clients who are first time moms or planning to be first time moms, we don't know. And that's one of the things I always say, we don't know. We know very little about how you're going to go through this pregnancy. The best we can do is understand who you are today and try to set your function as best we can with what you've been
Right.
given
Mm-hmm.
so that we can reduce any possibility of risk in this upcoming pregnancy. And we'll watch for certain things as we do. And if something pops up, we'll try to catch it early and then do our acute crisis management along the way so that it doesn't become detrimental to your pregnancy and birth experience.
Yeah. Yeah. Wow. Yeah. That's wild. I love learning about this because again, I just feel like there's just so many gaps in care and everybody has their own like area that you specialize in. And there's not like, one person that like your OB is a trained surgeon, a trained high risk doctor, very, very good for those situations.
Yeah.
But their nutrition education is very limited. Even the labs to run to look for things when it comes to PCOS, when it comes to infertility, when it comes to certain things, is still very limited.
Mhm.
I had an issue with OBs before I got married because my periods were really heavy. And then after my grandma passed, I had like this crazy heavy period that like I couldn't go to work that day. And just I had so many like clots coming out of me and I'm like, okay, I need to go to a gynecologist, like something's going on.
Yeah.
And of course their only answer was to put me on birth control. And I'm like, that's not an option for me. Like, I'm not going to get on birth control. I know that my body's trying to tell me something and I'd like to figure out what that is,
Yeah.
And so it can be really, really frustrating trying to find root causes of things and then not knowing that these things are affecting your pregnancy or your
Mhm.
fertility journey or your birthing outcome or your postpartum. And we're just told that's just what it is. Like the female body's an anomaly, like we just don't
We
have
don't know.
answers. Right. Totally. It's like you have hormones, you're a woman, it's
Yeah.
normal.
Yeah. And I always say we're only as good as the information we've been given and the tools in our toolbox.
Yeah.
And the OBs, the MFMs, they are doing what they're good at, which
Right.
is medical acute crisis management.
Right.
They're, like you said, their education in nutrition is lacking. And it's not their fault. I hate to say that way, but it's the medical system's fault. It's the
Yeah.
schooling's fault. The average amount of clinical hours put towards nutrition in the average medical school is 4 hours.
Yeah. That's wild.
That's it.
Right.
Right. You know how long it takes on average for somebody to actually learn the material?
Yeah.
40 hours. Right.
Yeah.
That's why we hammer children in school with the same material over and over and over again, just in different ways.
Yeah.
Because it takes on average 40 hours of repetitive learning to actually retain that information.
Right.
So they're doing the best they can with what they've been given. And I truly believe in collaborative medicine.
Yeah.
And I work with OBs, MFMs, I work with midwives. I work with a whole plethora of different practitioners around the world that we all have the same mindset, and that is to come together with what we know, because we all don't know everything. And the moment you think you know everything, you know nothing, right? To treat our patients in the most comprehensive way that we can.
Yeah.
Because we all have a little something to give. Right?
Yeah.
I have my specialty. I know what I do.
Mm-hmm.
I'm, pretty good at what I do, but there's areas in which I can still be learning. And there's
Right.
areas in which I fail because I'm not good at that. And I
Right.
can say, hey, here's my buddy. He's really good at this. Let's bring him into the picture.
Right.
Right.
Mm-hmm.
Because he's going to see it differently.
Yeah.
Because his education and his experience is different. And together, we can create a much better support system for these moms.
Yeah. So earlier you're saying like it kind of like the goal too is like to prevent these things in future generations. So basically that is saying that we are passing on things to our baby that is going to affect them. I mean, we're seeing that with fertility rates,
Oh, absolutely.
these days.
Absolutely.
Like there's people that are super, super healthy and like, it looks like there's no cause for infertility, but it starts when they're in the womb and the genetics that they were passed. And so it goes really, really far back.
Generations back often.
Yeah, that's wild.
Right? So you have to think, as a woman, I was an egg inside my mom whenever she was inside her mom. So I was in my grandma, which is so weird, right?
Right.
And so the experiences that my grandmother went through affect my genetics.
Yeah.
And there's a difference between genetic change, right, and genetic expression.
Yeah.
So this idea of epigenetics versus genetic change. A lot of these things are not sequential changes, right? You see sequential changes in like genetic issues and things like, trisomies, right? Or, the genetic expression of certain things, right? Physiological changes in people. Things like, the hemochromatosis genes, these SNPs, right? That's kind of different. When we're talking about epigenetics, it's the turning on and off of these genes.
Yeah.
Now, that's why you'll see things that say you have this gene. Let's just say you have a BRCA1 gene.
Yeah.
You now have an increased risk of breast cancer. It doesn't mean inevitable.
Right.
It means you carry a gene, you have a genetic change that increases your risk of tumor formation because BRCA's job is to be a tumor suppressor. We don't know if it's going to turn on. We have no idea.
Right.
And oftentimes the turning on of these genes happens when you're very young and it's out of your control. But there are things in which we know we can control to reduce that risk of these negative genes turning on. And that's epigenetics. So that's how diet, lifestyle, environment, mental health, stress responses play into genetic expression to some degree, genetic change.
Yeah. That's so
and
wild.
For some people, these genes get turned on before they were ever born.
Yeah.
And they're set up for failure from the beginning. Fertility is part of that, right?
Yeah.
A female's eggs are developing in her ovaries when she is in the womb. And so the behaviors of the pregnant mother do affect, to some degree, the next generation's ability to conceive.
Yeah.
And some of this is in their control. Some of it is, to some degree, out of their control. So things like, I feel like, to some degree, environmental chemicals have been slightly out of our control.
Right. Right.
Because we are pawns in a chemical game and it's just all around us, and we don't have much control over the chemicals that are used by companies around us. And these chemicals have been shown time and time again to be endocrine disrupting chemicals.
Right.
And we know that these chemicals affect hormone production. And there's a lot of research on these different chemicals that we are exposed to here in the United States on a daily basis that affect things like placental formation. So going back to preeclampsia, some of these chemicals are associated with placental dysfunction issues associated with preeclampsia, higher rates of that oxidative stress thing, actual genetic expression issues. Yeah. In those early phases of development, miscarriage rates, right? Poor fertility. We see that sperm counts and semen analysis of males has changed in the
Right.
last decades.
Oh,
It's gone down.
drastically.
And this is an element of stuff which I get a little frustrated and passionate about to some degree
Yeah.
because we're kind of pawns in the game, and there's things we
Yeah.
can manage and there's things we can control, choosing better quality, getting away from plastic as best we can.
Right.
But we
Eliminating
can't,
chemicals in your home,
yes,
I
eliminating
mean,
the
you're still going to
chemicals in
have
your home.
sunlight. I mean, it's in your furniture, it's in your carpet, it's in everything. But like,
Right.
let's say you switch out your cleaning products, you switch out,
Yeah.
fragrances or whatever, stuff
Right.
like that.
It's in agriculture. It's in the water
Right.
systems.
Right.
Right. And we don't have to be told that it's there.
Yeah.
Right. Glyphosates are a big one.
Mm-hmm. Yeah. Well, and it's what's crazy though, too, like that you're saying this is like, because our generation is having the awareness. Our parents did not, like there's ads of, people 40 years ago, moms smoking, pregnant. They used to be able to light up in the hospital, so if your grandma was carrying your mom who her eggs were developing and she was smoking and you're one of those eggs in her mom, then you're given that set of genes. Like you said, like you're there's things out of your control.
Right.
And it's like, not to blame our parents because they didn't know. Their doctors like, yeah, like I saw somebody posted like an ad from forever ago and they were like, the safer cigarette when you're pregnant, or you know what I mean? It's
right?
like, what? Like,
I think I saw one once that was a smoking one for pregnancy that had to do with preventing excess weight gain in pregnancy.
Oh my gosh.
Was to be smoking, and it would help you, curb your appetite.
Oh my gosh. Yeah.
I was like, oh my God, this was a thing. My heart hurts. This is so
right.
bad.
Right. And I mean, and you're thinking about like, yeah, just crazy things that have happened that our parents didn't know. Like that's when even a lot more of the chemical type stuff came out, was like in our parents and our grandparents.
Yeah, sure. They were as good as the information they were given.
Right.
And that was the information they were given.
Yeah. Right.
So, and that it does play into it. Absolutely. You'll see studies that talk about decisions that you made in childhood affecting your fertility. So there was a study, and I posted it on my Instagram not too long ago, that talked about men in particular who smoked in their adolescence and decreased fertility in adulthood.
That's crazy, because I was telling you before this that like I've had friends who have gone through fertility journeys who are working with IVF doctors whose husbands smoke a pack a day, and their IVF doctor has been like, no, he doesn't have to quit smoking. And it blows my mind. I'm like, you are a medical doctor. Yeah. So smoking's not okay in general. A lot of things we do, like alcohol's not great for you. Like there's so many things, but it's like to say that this isn't going to affect your fertility journey blows my mind. I can't even like wrap my head around it. It's like really frustrating.
And in the ideology of the fertility docs, their job is to get you pregnant. And if they're looking at that semen analysis and going, it's enough, I can spin out the bad guys and I got enough to work with IVF.
But you don't know the health of it,
Well, that's that long-term game. And in our society, we don't really spend a lot of time looking at the long-term game.
Right, totally.
We look at the immediate, what do I need to do to make this single goal happen? All right, goal's done, right? Birth. What do I need to do to get the baby out? Not what does this experience do to the next generation and the person in the room? It's operation get the baby out.
Right, totally.
But method of birth matters.
Yeah.
Right? You see that for that child for the rest of their life. There's study after study after study that links surgical deliveries with increased autoimmune disease, allergies, and immune system response issues because they didn't get a microbiome.
Right.
There's new studies that now link that GBS and antibiotic use with the same pattern, if not worse.
Totally. Yep. That's like some of the stuff that, again, you're just like not really educated about. And there's things that happen that are out of your control. With my first pregnancy, I didn't have like any antibiotics or anything, but my daughter did end up in the NICU and had to be on 2 different antibiotics the first week of her life. And I know that she has gut health issues, and we've done a lot of work, but I also knew like, then you're not educated on like with cesarean birth, with antibiotics at birth, this is going to affect your child's immune health, their immune system, their gut health, their microbiome, and that breastfeeding then is the best thing you can do to help restore that. Like, they're not like, hey, since these things happened, let's really try to support this as much as possible. At least, some like, and I actually interviewed, somebody who deals with like gut microbiome, when we talked about that a little bit. But like the system isn't set up for that. So it's like, why are we seeing so many more, like such an increase in autoimmune diseases, in allergies? And I think that that's just one small piece of the puzzle. I feel like there's so many factors. A lot of people like to point to one thing and be like, this thing is causing all the issues. And it's like, no, it's chemicals in our soil. It's, the increase in surgical births. It's, our food, our environment, so many things. But then, you're not set up for success, right? So if you were a kid who maybe was born via cesarean, who was formula fed, who had chronic ear infections as a kid, so you were constantly on antibiotics, that can even affect anxiety later in life. Like you're like you said, there's that brain gut health connect. And so you can have higher anxiety later in life because of lacking of gut microbiome. And so you're not told any of these things, and things are out of your control. Like I said, like cesareans are needed. There's times when you have to get a cesarean.
There is a time and a place for medical intervention.
Totally.
Absolutely. I've seen it. I've even, I've had clients in the past who were, really, really, and it just breaks your heart to see, don't want that. And you have to tell them, listen, like, I think you need it. This is that scenario where, thank God we have this medical care.
Right.
Because people do need it.
Right.
And there's people who don't, right? We have this whole game.
For sure.
But like you said, there's no after fact. It's not like, okay, we needed this. Here's how we now support you, because we can control what we can. We have to let go what we can't.
Right.
Right. And here's the next action plan to help you and your baby recover from this different scenario.
Right.
Right.
Right. Yeah. It's like one of those like things where it's like, if you answer B, then you go to the next thing, and then you answer this. And like, we don't have that. And I remember like knowing that when my daughter was born, I'm like, man, she's on antibiotics. I know that that's going to affect her gut health. And I was really sad about it. I did get like an infant powder probiotic that I'd put on my nipples, like when she would nurse a little bit, but I really started to see it when she was eating solids, because I was cloth diapering, and they were like, at this point, when they start eating solids, their poop changes, you can do this. And she didn't have solid poops for like 2 years of her life. It wasn't until like recently, like she always had loose stools. And she had some eczema stuff. We went to an allergist, and they're like, oh, she has like minor dust allergies, but that's it. And I'm like, this isn't it. Like, it's so hard finding root causes, and you want to like set your kids up for success, but there's that lack of knowledge. Your pediatrician isn't telling you, your OB is not telling you, and you just don't know what's going on. And then the affordability of like insurance isn't covering these alternative methods to, search out root causes. And just like, not knowing that these are signs of maybe something else. So it can be like really, really frustrating. Also, when you start to learn the knowledge, because we're like, okay, our whole family needs to go see a functional medicine doctor. And that's like, for all of us to go, like crazy expensive, so it's like, okay, so whose health is the worst? Like, who wants to go first?
Who's got the priority here?
Right. Because we all have gut issues and different things. And so it can be such a battle, but with infertility, with miscarriage, when it comes to these different things, like, you're not told like those things either. Like, you don't know, like, some of these are a set of genes that you got from birth. Like, it's nothing that you did. Maybe you made great, healthy choices your whole life. And even like the trauma. So like when you're talking about like the stress receptors, because I've even wondered about that for me. Like when my mom was pregnant with me, my dad was almost killed in an accident, and he was in the hospital for a long time and like broke tons of bones in his body. And the nearest the hospital he was at was like hours away from where we lived. And I know it was a super stressful time for my mom. So I'm just like, oh man, like, how did that like affect my life now? Because I was like in utero. She's taking care of other kids. I'm the youngest of 4. And pregnant with me and being like, am I going to be a single mom with 4 kids? Like, like, I'm like, how did that stress in her pregnancy affect me. And also I was an induction birth.
Mhm.
And there's some research, with that as well.
Sure.
So I'm like, who knows? Like maybe I was just given this set of genes where I'm gonna have gut health issues my whole life, even though I'm
Mhm.
like making healthy decisions.
Well, and there is an element of that.
Hmm.
Absolutely. That does play into things.
Yeah.
And I have seen studies that say that some of these epigenetic changes last multiple generations,
Mm.
right? Like if you made changes, I forget what study it was. It was a while ago. It was a cat study. And I forget what they did. I'd have to look at it before I quote it. Probably shouldn't even say anything. But what they did is they made these epigenetic changes in cats. And then they started breeding healthier cats, right? Like, hey, let's put them, let's see if we can how long does it take us to make them healthy again? And it took, I think it was upwards of like 7 generations
Oh my gosh.
for these cats not to express that negative genetic anymore.
Hmm. Interesting. That's so interesting. Well, we'll wrap up, but I feel like we could go like 100 different directions here because I'm
I know,
like,
right?
I love these type of conversations and I love learning more. So I feel like I have like a million questions I could ask you about this. Um, because I mean, we are seeing different genetic mutations pop up and all these different things. I'm pretty sure I have this one. I don't remember what, I'm gonna butcher it. I don't remember what it's called. Something to do with histamines.
Hmm.
Is it something with DOA or is that the supplement you
Oh,
take for it?
DAO, diamine
DAO.
oxidase.
I think I have something with that, but
Yeah.
I'm just, self-diagnosing myself. I didn't like see anybody about it. It could be something completely different. But yeah, it's a super interesting conversation because I think it's so easy for us to take the blame for things that are out of our control. And like you said at the beginning, like control what we can and let go of what you can't. Like I can't control what's in the environment outside. Even in my house, like I said, I mean, there's stuff in everything. And it's like, okay, if we wanted to completely remodel our house and only use like cork flooring that's non-toxic, we can't afford to do that. Like
Right.
we can't afford to make those changes. What can I do? I can put a little air filter in my kids' rooms. I can choose,
Mhm.
certain things that I know have less toxins in it. I can eliminate plastic from the home and nonstick cookware and things like that. So it's just literally small changes that we can do, but there is a whole world of things we can't. And so that can be really, really frustrating. It can be empowering learning information, and then it can also be disheartening when you feel like
Mhm.
everything's just killing us. Um,
Absolutely.
so my husband actually just said that last night. He's like, everything's killing us. I'm like, I know. I'm like, you talk to one person in health and they're like, don't eat broccoli and kale because of, the whatever things what's the thing in there that like,
The goitotropins, the one that
I
make
don't,
your thyroid.
I don't know, something with thyroid, but then also
Yeah.
they have like this thing that they dispel to like make you not want to eat them.
Oh,
Um,
yeah.
and then it's like, and then don't eat meat because of this thing and don't eat that. It's like, okay, so literally every single thing is not good for you. And so it's like you dive into it and it can be like super, super frustrating. And so you have to let go and be like, no, it is good to eat fruits and veggies and protein
Mhm.
and,
Yeah.
like do what we can. But it's also empowering learning this information. But we do take so much blame, I think, especially for women, for miscarriage, for trying to conceive, for
Yeah.
fertility. And I think it's also empowering knowing that some of that, like, it was nothing that we did.
Right.
It wasn't that even in pregnancy, like I remember with my first miscarriage, I'm like, oh my gosh, was my bath too hot? Like, was that something that I did? Like, what did I do wrong to cause this to happen?
Yeah.
And like you said, it's like the months and weeks leading up to that, like those first couple months, there's not like much you can do. But and it could have been things that I wasn't knowledgeable about or knew that deficiencies or
Right.
whatever it was.
And it
Um,
could have just been a bad egg and a bad sperm,
Right, totally. I mean,
right?
if it's not a healthy pregnancy, our bodies are smart and they're gonna be
Yes.
like, okay, this isn't probably gonna work out, so we need to go ahead and release it. Um, my husband's very logical like that, he's like, no, he's like, it's good that your body knows what it's doing and it's not trying to carry on a baby that wouldn't be healthy or like
Yeah.
wouldn't be formed correctly or whatever it is. But it's so easy for us to beat ourselves up, to take the blame and to um just feel like we have to try to control everything but then nothing's in our control.
Mhm.
So I love conversations like this. And I just want to thank you so much for your wisdom today. Tell us about your book before we wrap up and where people can find and follow you at.
Yeah, so my book is Functional Maternity, Using Functional Medicine and Nutrition to Improve Pregnancy and Childbirth Outcomes. You can buy that off of Amazon. You can buy that from your favorite local bookstore. Just go in there and you can special order it or ask them to carry it. Yay. You can always find me on Instagram. It is functional.maternity. And then if people have questions, they're always welcome to reach out to me via email, hello@functionalmaternity.com. You can also visit my website, functionalmaternity.com, where I have lots of articles and downloads, some free, some paid for, and you can always connect with me there. People who are interested in becoming a patient, go to the website. You'll see a link to the clinic. I always offer free 15-minute phone consultations with prospective clients. So if anybody just wants to have a chat, see if functional medicine is something that could benefit them, I do free calls.
Awesome. That's so great. And then last question before we wrap up, and I'll include all the links in the show notes for everybody listening so they can find you easily. Since the podcast is Morning Chava, I like to ask how you take your morning Java. Do you drink morning coffee? And if you do, how do you take it?
I do, and I take it black.
Yeah. I'm interviewing a lot of people that just drink black coffee, and I'm like, that's great. I used to, but now I add a lot of stuff in it. So
do you?
Yeah.
If I get spunky, I throw some mushrooms in there.
Okay. Nice. I've been actually wanting to try mushroom coffee. I never have. But I really want to switch to chicory root. So that's the switch I would like to make. It's just finding a good one. But thank you so much for coming on the podcast, for all your wisdom and expertise. Like I said, I feel like I could ask you a million questions, mostly about my own personal problems. So I won't do it on here. But I just want to thank you so much for coming on the podcast today.
Yeah, thank you for having me.